Hi, my name is Danica Denman,
Campbell Blair,
Chase Trujillo,
Caitlin Edling,
Brittany Wall.
and we will be walking you through the measurement, evaluation, and program design of our client.
Our client, who recently expressed a strong desire in their shoulder recovery, they've been noticing an increased discomfort and limitations, which had led them to commit fully to their physical therapy. Their main goal is to regain the strength and mobility they need to return to their activities they enjoy, like swimming and pickleball, without fear of re-injury. Our client's motivation and focus on functional movement make the manual muscle test and the range of motion testing specifically relevant. These assessments provide a baseline and ongoing checkpoints to evaluate progress in shoulder strength and mobility. As we build their recovery plan, these tools will help us tailor exercises to their needs and adjust the program based on objective improvements. The manual muscle test can highlight specific muscle imbalances or weaknesses, while the range of motion testing helps us see improvements in their joint mobility, both critical for their long-term goals of safety, confidence, and movement. Integrating these measurements into the process not only guides treatment, but also reinforces the client's sense of progress and keeps them engaged in their recovery journey.
When designing a recovery program for shoulder injuries, particularly following rotator cuff repair, it is essential to prioritize strategies that support tendon healing and minimize tear size progression. According to a retrospective study analyzing 442 patients over a 2-year period, those with healed tendons and reduced tear sizes demonstrated significantly better shoulder function and muscle strength compared to those with non-healed tendons or increased tear sizes.
When evaluating our client, we noticed that she had a weak muscle force output in her right rotator cuff, and the internal rotation of her right shoulder was 74 degrees compared to her left shoulder, which was upwards of 90 degrees. This has led us to form the SMART goal that within 6 weeks, the client will achieve 90% or greater pain-free active shoulder range of motion compared to the uninjured side as measured by a physical therapist. The other SMART goals that we have chose for the client were to support the client's PT progress. She will do a 15-minute to 20-minute at-home routine focused on the shoulder mobility and core strength at least 3 times a week, beginning at the beginning of the week and also continuing for the rest of the month. The last SMART goal that we have chosen for her was starting this week, our client will track her recovery by writing in a journal 3 to 4 times per week, noting how her shoulder feels, her motivation, and any questions that she has for her PT. And she'll continue to do this for the rest of the 4 months.
According to a research article posted in the American Journal of Sports Medicine on the treatment of superior labral tears, 62% of baseball players are able to return to play after the non-surgical treatment route, consisting of rotator cuff exercises and internal rotation stretches like the sleeper stretch. And this has guided our program design, which Chase will explain to you.
Okay, moving into the exercises that we're going to be picking, the first is going to be IYT raises, and the rationale behind this is that it works the lower and mid traps as well as the rhomboids and the posterior deltoid as it occurs in the frontal and the sagittal plane. This is going to help her just build that overall shoulder strength and just allow for greater movement. The second one is going to be cable internal rotation. This is a very easy exercise to limit so that way she's not injuring herself. This is going to work that subscapularis, which is part of the rotator cuff. It's going to help her be able to rebuild that up. Next, we're moving into bottoms up kettlebell press. This is going just to work overall shoulder strength as well as stability with that elbow extension and shoulder flexion. Then we're going into cable lateral raises. This is going to keep the tension on her shoulder the entire time as it works that lateral delt. This is going to help her just build overall strength and continue to increase that range of motion. The next is going to be cable rows. This is going to work posture as it targets all of the muscles of the mid back, really working those lats, as it occurs in that sagittal plane. The sixth is going to be assisted pull-ups with band. These are going to help her as not putting all of that pressure on that shoulder joint. It's going to be able to work her up as needed and adjust the weight as necessary These are really going to work the lats and the biceps, really just targeting that shoulder joint, not putting too much pressure on it. The last one is going to be knee push-ups. These are going to prevent her from having her entire body weight on her hands, and be able to adjust that weight as needed. So all of these exercises directly involve the shoulder, and so these are just going to help her build her shoulder strength as well as her posture and get her back so that way she can meet those goals.
Okay, so today we're going to be walking the client through a knee push-up. And to find your arm positioning, what you're going to do is you're going to put your arms out wide, and then you're going to put your arms forward and then bring them straight back. And you want them here to target your pecs. If you go too far out, it's going to target more so your shoulders, and then if you go closer in, it's going to target your triceps more. So this is what you're going to do. You're going to go down, you're going to engage your back by coming up like a Superman position, and then you're also going to put your legs up and cross. Then from there, push up, and you're really going to keep your core stable and don't like flop around. Yeah, keep it stable. Go down and back up, and then all that time really sucking those lower abs in. Okay, now flex your yeah, there it is. That's good. Way to engage your back. Good job. And crossing. Okay, now go ahead and lift up when you get the chance. Nice. Good core.
Are my arms at the right position?
Yes, I would say so. Yeah, when you go up, try to keep your whole back as flat as possible. You're kind of going up and over. Yeah, that was better. Good work. How does that feel?
My shoulder doesn't hurt,
Okay.
so that's good.
Yeah, that's improvement.
And I feel stronger.
Nice.
By working in the CLC together, we were able to learn how to collaborate and work together to design a workout program for our client. Thank you so much for watching, and I hope you have a blessed day.